Hello everyone. The next developmental disturbances of tongue that I'll discuss is hairy tongue. Coming to introduction, these are some other names for hairy tongue, that is lingua nigra, lingua villosa nigra, or black hairy tongue. These are some other names for hairy tongue. Hairy tongue is characterized by there is marked accumulation of keratin on the filiform papillae of the dorsal surface of the tongue that resulting in a hair-like appearance. In the picture you see on the dorsum of the tongue there is brown color and hair-like appearance is seen. Those are basically filiform papillae, but there is more accumulation of keratin. So it represents an increase in keratin production और a decrease in normal disformation of keratin. ये basically क्यों होता है? Because there is an increase in keratin production. Keratin production increase हो जाता है और जो normal keratin disformate होता है, जो normal keratin निकल जाना चाहिए, वो वहाँ पे deposit होता जाता है. There is a decrease in normal disformation of keratin layer. So there is a deposition, so it appears like hair-like structure. So it is known as hairy tongue. Hairy tongue may also appear brown, white, green, pink, or any of a variety of colors depending on the specific etiology and secondary factors. For example, use of colored mouthwashes, breath mints, or any candies or some chromogenic bacteria. Because of these regions, it appears brown or black in color. Then etiological factors for hairy tongue. The basic defect in hairy tongue is the hypertrophy of filiform papilla or enlargement of the filiform papilla on the dorsal surface of tongue, usually due to a lack of mechanical stimulation and debridement. This condition often occurs in individuals with poor oral hygiene. For example, lack of toothbrushing, eating a soft diet with no raw face that would mechanically debride the dorsal surface of the tongue. Other contributing factors like your tobacco use, coffee or tea drinking, and many of the people they are affected, they are heavy smokers. Other possible etiological factors like antibiotic therapy. There is some patients they are under antibiotic medication, patients undergone radiation therapy, any use of oxidizing mouthwash or any antacid. There is an overgrowth of fungal organism or bacterial organisms. So these are some contributing factors or the possible etiological factors for hairy tongue. Then coming to clinical features of hairy tongue. The normal filiform papillae are approximately 1 mm in length, but in case of hairy tongue, the filiform papillae are more than 15 mm in length. It has been reported with greater frequency in males as compared to females. Patient with hairy tongue, they are infected with HIV infection. Hairy tongue is rarely symptomatic, although overgrowth of Candida albicans that may result in glossopyrosis. Glossopyrosis, that means burning sensation on the tongue. Patient frequently complains of a tickling sensation in the soft palate and the oropharynx during swallowing. In more severe cases of hairy tongue, patient may actually complain of gagging sensation. Retention of oral debris in between the elongated filiform papillae may result in halitosis or bad breath. There is no racial predilection in associated with hairy tongue, and it most commonly affects the midline of the tongue just anterior to the circumvallate papilla, sparing the lateral border and the anterior border of the tongue. So the tongue has a thick coating in the middle of the tongue with a greater accentuation towards the back surface. And there is bacterial and fungal overgrowth play a role in the color of the tongue. Then the complication of hairy tongue. The only complication associated with hairy tongue is occasional candidal overgrowth, which often results in an uncomfortable glossopyrosis, that is burning tongue. Altered taste sensation is a rare complication in case of hairy tongue. Then differential diagnosis. This condition has to be differentiated from candidiasis, leukoplakia, oral lichen planus, and oral hairy leukoplakia. To rule out candidiasis, it should be culture of the tongue's dorsal surface. Then, because of the similarity in name, care should be taken to avoid confusing hairy tongue with hairy leukoplakia. The name is similar, hairy tongue and hairy leukoplakia. Hairy leukoplakia is caused by Epstein-Barr virus, EBV, and usually associated with HIV infection or other immunocompromised conditions. Histopathological features of hairy tongue. There is elongated filiform papilla. You can see in the picture there is elongated and marked hyperkeratosis of the filiform papillae with bacterial accumulation on the surface. There is mild hyperkeratosis, that is deposition of keratin layer on the surface, and occasional inflammatory cells present in the connective tissue. Usually numerous bacteria can be seen that growing on the epithelial surface. In the histopathological picture you see there is elongation of, you can see the papilla, there is finger like projections, you see there is elongation of filiform papillae which are with hyperkeratosis. The treatment plan and prognosis of hairy tongue. The treatment of hairy tongue is variable. It is a benign condition with no serious sequelae. The major concern is often the aesthetic appearance. Because of the hairy-like appearance, it is more unaesthetic. So, because of the aesthetic appearance of the tongue along with associated bad breath or halitosis. Any predisposing factors like your tobacco, antibiotics or mouthwash, it should be eliminated. Any predisposing factors, those should be eliminated, and excellent oral hygiene should be maintained. Another treatment plan is surgical removal. Surgical removal of the filiform papillae by using electrodesiccation, carbon dioxide laser, or even seizure is the treatment of last resort when less complicated therapies prove ineffective. The prognosis is excellent, and if the precipitating factors cannot be adequately controlled or compensated for hairy tongue, patient may have to make tongue brushing or scraping part of their daily oral hygiene regimen. So these are all about hairy tongue. What are the etiological factors, what are the clinical features, and how it appears, and what is the treatment plan for the hairy tongue. So please subscribe to this channel to see some more upcoming videos. So thank you so much.